Think about something over there. You're looking over there. Yeah. So, she wouldn't tell me anyway. So, can you raise your chair up a little bit more, as high as it'll go? Yeah. Yeah, you want your tippy toes to kind of touch, just kind of point, plantar flex. Good. Okay, so, do you have any scissors? So, a person that has a tendency to have problems with the transverse ligament, they're not going to like flexion a lot at their OA joint and AA joint, because what will happen is when they flex, if the transverse ligament is lax, the odontoid will like kind of tip back and possibly touch or come into close proximity of the spinal cord. So basically what you do is you have a person go into some OA flexion and AA flexion, so just like a slight amount of flexion, okay? And that might be provoking for them to be in that position. Could be. The other thing is, and your book shows this, I don't have the book up right now, but do you see an arrow like that? That arrow is in line with the atlas and the axis. It's trying to stay parallel with the atlas and axis. So you're going to have your finger on the axis, this big spinous process of the axis. So I want you to kind of think about your direction of push being in the direction of that arrow. You guys follow me so far? So you have to have some palpation skills here, right? So you have to have them slightly flexed, and you'll feel the big old C2 pretty easy. Take your fingers. He shows it like this. I was taught by Lamb, he kind of uses fingers like this. It doesn't matter. It just, you got to get on, you don't want to push on the spinous process so much, you're just on the sides of the spinous process. But just like this, and then you take your other hand, and you're going to cup the occiput, okay, like this. And then what I'm going to do is I can do a couple of things. I can push anteriorly on the C2, okay, or I can just stabilize. That's probably the better thing, just to hold it. And then I can shift her head in a dorsal direction, right? So if I push her head in a dorsal direction, okay, and her atlas goes with it, which way does the axis go with the odontoid? Relatively anterior, okay? So that's the thing. It's just a slight amount of motion, okay?
Rotate your body and her as a whole about 20 degrees so they can see it better on the camera.
Hold on.
To the right.
Hold
No,
on.
the other way. There you go. Now do it again. Now show them the test again.
Oh, they want me to rotate again.
Please.
I'm a lot today. All right. Try to get my forearm in that so you see that plane. And it's just a shift back. It's almost like you could just tighten up your biceps just to kind of move their head back a lot. And again, you might not even feel anything. And you know what? If you don't feel anything, is that a good or a bad thing? It's a good thing. Yeah, because you don't want to feel something. Okay? But if you're here and they're feeling a little icky and you push them back to, ooh, I feel better. Sunshine just came out of this cloud. Good. Or you do this, you push them back and you feel a clunk. Or you push them back and it goes like 10 millimeters. Ooh. Okay? That could, be something. I think they say on the order of like 3 to 4 millimeters. But I can't. I'm not good at 3 to 4 millimeters with my arm. I'll be honest with you. Okay? But do you understand the mechanics of the test? Who gets it? How, what's going on mechanically and how to do it, right? And what are the abnormal findings? Excessive motion, reduction of symptoms, clunking, okay, or subluxing, okay? And what is it really testing? Transverse ligament integrity. Okay. Any other comments at all?
I had a patient who had RA and she had to screen her for something else, and she said, every time I flex or bend my head forward, I get tingling down both arms. And she had a positive test. So when she bent forward, and then we did the reduction, the tingling went away. So that would be considered a positive test.
Yeah. Relieving symptoms, okay, versus provoking. You guys know whenever you hear bilateral, right, your ears pop up, that's something central possibly.
Yeah, on one of my rotations, we had a patient that was positive, and a clinical symptom that they may report is like a lump in their throat. It felt that the patient reported feeling like when she bent forward that she had a lump in her throat that would disappear whenever she tilted back. So, again, that's something to take away.
That was the dance.
That was the dance.
Little orthopedic humor there.
That's funny. Orthopedic humor. All right, let's go check it out.